If you're thinking about taking the plunge and piercing your ear cartilage, it might be tempting to skip the piercing parlor and do it yourself. But, while a ear piercing may be a good way to save some money, you're probably wondering if it's worth the risk. In this article, we've answered some of your most common questions about self-piercing, including whether you can do it safely. So, we are going to watch about the is it safe to pierce your own cartilage?
Method 1. Should I pierce my own cartilage?
First is if you do it yourself, be careful and use proper equipment. Professional piercers follow strict protocols to make sure their clients stay safe. To reduce your risk of injuring yourself or getting an infection, you'll need to use a sterile needle that's designed for piercing. It's also important to make sure that your ear, your work surface, and any other equipment you use are properly cleaned and disinfected. If you've had success with at-home piercings before, or if you have other cartilage piercings and already know how to care for them properly, then you may have less risk of ending up with serious complications.
Step 2. Going to a professional piercer reduces the risks.
The pros are trained in how to properly disinfect their equipment and keep the piercing environment safe and sterile. They also have a good understanding of how to perform the actual procedure with the least amount of pain and damage to your ear. Plus, they can answer any questions and give you guidance on how to take care of the piercing afterward. Unfortunately, piercing your cartilage is a little trickier than piercing your earlobe. If you don't do it right, you could injure yourself or end up with a serious infection. Healthcare professionals recommend going to a professional piercer for any kind of piercing. But it's even more important for risky ones, like cartilage piercings. Finally, don't do it if you have diabetes or other health issues. The cartilage in your ear is particularly prone to severe infections after piercing. The risk is even higher if you have certain medical conditions, such as diabetes, heart disease, or a weakened immune system. Even if you plan to get it done by a pro, it's a good idea to check with your doctor before getting a cartilage piercing if you have any serious health concerns. Method 2. What equipment do I need to pierce my ear cartilage at home?
First is purchase a piercing needle in sterile packaging.
Look for a hollow piercing needle or catheter needle. A piercing needle is just a hollow metal needle, more common in the US, while a catheter needle has a bit of hollow plastic tubing attached, usually used by pro piercers outside the US. You can buy these needles online or from a body jewelry or tattoo supply store. Common sizes for cartilage piercings are between 16 and 18 gauge. Keep in mind that the lower the gauge number, the larger the needle will be. So, a 16 gauge needle is thicker and will create a larger hole than a 17 gauge one. Don't try to pierce your cartilage with a pushpin or sewing needle. Doing so could lead to an infection or do more damage to your ear. Piercing needles are sharper, and are specially designed to create a clean hole through your skin and cartilage that's just the right size for your ear jewelry. Buy piercing needles that are made for single use. Using a needle more than once can increase your risk of infection. Some piercing needles are designed so you can slide or screw the post of your jewelry into the end of the needle. This allows you to guide the post directly into the new piercing hole as you pierce your ear, which is a little less traumatic than pushing the jewelry through the fresh piercing after the fact. Step 2. Get an earring that's 1 gauge sized smaller than your needle. That means the gauge number should be slightly higher, since a higher number means a smaller gauge. For example, if you're using a 17 gauge needle, you'll want to get an 18 gauge earring. This will help ensure that the earring fits easily into the hole. Go for an earring that's designed to work in an initial cartilage piercing. These earrings should be internally threaded, meaning that the backing should screw into the post of the earring instead of the other way around. Or threadless, meaning that the backing clicks into place instead of having to be screwed in. Make sure the earring is made of a material that's hypoallergenic and won't cause irritation. Some good options include titanium, surgical steel, niobium, platinum, and gold that's 14K or higher. Check that your jewelry is nickel and cadmium free. Purchase jewelry that's already sterilized. You can get pre-sterilized, pre-packaged jewelry online or at a body jewelry store. Unfortunately, There's no good way to properly sterilize jewelry at home unless you own an autoclave.
Step 3. Buy a package of piercing corks.
These are small corks that help stabilize the needle during the piercing process. You can purchase them online or from a body jewelry store. Piercing corks don't need to be sterile, but they should be clean. So don't use a cork that's already been used for another purpose. Finally, you'll also need gloves, gauze pads, and antiseptic skin wipes. It may also be helpful to get a package of disposable medical towels for covering your work surface. You can get these items online or from your local drugstore. You'll use antiseptic wipes, such as alcohol wipes, to clean and disinfect your ears before piercing them. Gauze pads are helpful for stopping any bleeding after you complete the piercing. Method 3. How do I prepare to pierce my cartilage?
First is sterilize your work surface.
For instance, if you're working on a table or bathroom counter, wipe it down with soap and water. Then, disinfect the surface with a disinfecting spray, such as Lysol or Microban. Read the instructions on the disinfectant to make sure you know how to use it properly. If you don't have any spray, wipe the surface down thoroughly with disinfecting wipes, such as Lysol or Clorox wipes. If you use disinfectant wipes according to the package directions, they should be just as effective as a spray product.
Step 2. Wash your hands thoroughly.
Before handling your equipment or your ears, wash your hands with soap and water for at least 40 seconds. Make sure to scrub all surfaces of your hands, including your palms, the backs of your hands, and the areas between your fingers. Dry your hands thoroughly with a clean paper towel when you're done.
Step 3. Put on clean or sterile medical gloves.
You can buy these gloves online or from your local drugstore. To put on the gloves without contaminating them, pick up the first glove by the cuff with your non-dominant hand. For example, if you're right-handed, use your left hand to pick up the glove. Hold the glove so it's hanging with the fingers pointing down. Then slide your dominant hand into it with your fingers spread and your palm facing out. Repeat this process with the opposite glove. Adjust the gloves so that they fit properly.
Step 4. Lay out your supplies.
If possible, put down a sterile disposable towel, which you can buy online or from a pharmacy. Put your earrings and needles down on the towel, along with the antiseptic wipes, gauze pads, and piercing cork. Step 5. Wipe the area you want to pierce with an antiseptic pad. Swab the pad over the area using circular motions. Make sure to wipe both the front and back of your ear.
Finally, mark the spot you'd like to pierce.
Use a body marker to make a small dot on the exact spot where you'd like your jewelry to go. When you place the dot, be mindful of how the piercing will look. You want it to be easily visible when someone is looking at your face straight on. Also, be sure to position it so the needle will exit straight out the back of your ear and not into your head. You can get body markers or surgical skin markers online or from a body jewelry supply store. If possible, get someone else to look at your ear and make sure there aren't any visible blood vessels in the spot you'd like to pierce. Make sure the area you plan to pierce is actually over the cartilage of your ear. If you pierce through just the skin and not the cartilage itself, your piercing won't be as stable. You can pierce the cartilage on just about any part of your ear. But take care not to put your new piercing too close to any jewelry that's already in place. You don't want the earrings to touch or overlap. Method 4. What's the right procedure for doing the piercing?
First is take the needle out of the package.
Peel open the packaging on your piercing needle and carefully remove it. There will typically be a plastic cap on the sharp end to prevent you from accidentally poking yourself. Once you're ready to pierce, pull off the cap. If you're using a needle that's designed to hold the jewelry while you do the piercing, load the earring into the needle now. Step 2. Place a cork behind the spot you'd like to pierce. This will help create a bit of extra stability and support. Rest the cork against the back of your ear. When you push the needle through, the point will go into the cork.
Step 3. Push the needle quickly through your cartilage.
Sit in front of a mirror so you can see what you are doing. Make sure the needle is straight and parallel to the side of your face. Take a deep breath, and in one smooth motion, slide the needle through your ear and into the cork behind it. You might feel or hear a pop as the needle goes in. It's also normal for the piercing to pinch or burn. If there's an earring loaded into your needle, keep sliding the needle all the way through until the post is in place and the stud is resting against your ear. The end of the needle will go through your ear and into the cork behind it. Don't pull the needle out of the cork and back through your ear. Instead, pull the needle all the way through your ear and out the other side. Finally, slide in the earring and put on the backing. If the earring wasn't already loaded into the needle, carefully slide the post into the hole you just made. Screw on the backing or slide it onto the post. If your earring isn't threaded, some initial piercing earrings are designed with extra long posts so that there's room for your ear to swell a bit in the first few days after the piercing. Method 5. How do I take care of my ears after piercing them? First is wash your hands with soap and water before touching your ear. Touching your ear with unwashed hands can introduce bacteria and dirt into the area, which increases your risk of infection. Anytime you need to handle your piercing, wash thoroughly first. Pat your hands dry with a clean paper towel when you're done. Step 2. Soak the area with saline for 5 to 10 minutes a day. You can either buy a saline rinse at the drugstore or make your own. Soak a clean piece of gauze in the solution and hold it on your piercing for several minutes. When you're done, carefully rinse the area with clean water. You can do this once or twice a day to help soothe and disinfect the piercing. If a bump develops around the piercing area, soaking it in warm water or saline can help reduce the swelling. Depending on how serious the swelling is, your doctor might recommend soaking the area for up to 20 minutes, 3 to 4 times per day. Finally, clean the area with soap and water once a day. When you shower or wash your hair, put a drop of mild, fragrance-free liquid soap on your ear and gently lather it up. Leave the soap there for 30 seconds before rinsing it away. Avoid using harsh soaps or antiseptics, such as alcohol or hydrogen peroxide. These can damage your ear tissue and slow down the healing process. The Association of Professional Piercers doesn't recommend using any kind of antibacterial cleansing solution, even ones that are labeled for use on pierced ears. Rinse your ear thoroughly after cleaning it so there's no irritating soap residue left behind. Pat the area dry with a clean, dry paper towel when you're done. Don't use a cloth towel, since even freshly washed towels can be breeding grounds for bacteria. Plus, the cloth might snag on your new jewelry. Method 6. How can I help my piercing heal faster? First is leave the piercing alone except when you're cleaning it. The more you mess with your piercing, the greater the risk of irritation or infection. Resist the temptation to touch, scratch, twist, or fiddle with the jewelry or your ear.
Step 2. Avoid putting pressure or friction on the area.
Don't wear clothes that might rub or tug on your piercing, such as hats or hoodies. Be extra careful not to snag your jewelry when you brush your hair. When you sleep, try to avoid resting your head on the side with the piercing. Or carefully shape your pillow so there's an indentation under your ear.
Step 3. Expect healing to take several months.
Unfortunately, ear cartilage piercings take a long time to heal. It may take anywhere from 4 months to a year. Be patient and keep caring for your ear properly during that time so that it heals as fast and smoothly as possible. Don't take your initial earrings out or swap them for different earrings until the piercing is healed. If you're not sure whether it's fully healed yet, see a doctor or a professional piercer for advice. Typically, a piercing that is fully healed won't appear red and will not produce any new discharge or crusting. The area should also feel normal, not itchy or painful. However, a piercing can sometimes appear completely healed before it actually is. For this reason, it's important to keep taking care of your piercing for at least a full 4 months, even if it seems healed sooner than that.
Finally, watch out for signs of infection.
It's normal to see a little bit of redness and crusting around a new piercing. It might also itch a bit for the first few weeks. However, if you notice redness or swelling that spreads or worsens, If the area feels hot or tender to the touch, or if you see blood or pus leaking out of the piercing, then you may have an infection. Cartilage infections can be serious, so see your doctor right away if you notice any of these symptoms.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.